Still on the extra points, let's now talk about the points Qimen, or the Qi gate, or the EX-CA extra point, and Zigong, the child palace, or the EX-CA-1 extra point. Let's start with the Qi gate, or Qimen. It is located 3 tions lateral to the anterior midline and 2 tions superior to the upper border of the pubic symphysis. How to find this point? The distance between the center of the umbilicus and the upper border of the pubic symphysis is divided into 5 proportional tions, which can vary considerably from the patient's finger tune. Therefore, only the proportional tune measurement should be used with a helpful device. You can use an elastic tape. And then from the border of the pubic symphysis, measure 2 tune in a cranial direction towards REN4. And from there, measure 3 tune in a lateral direction. There, locate Qimen. Located on the same level are kidney 3, which is 0.5 tune lateral to the midline, EX-CA extra point, which is 1 tune lateral to the midline, and stomach 28, which is 2 tune lateral to the midline, and EX-CA's extra point, which is 4 tune lateral to the midline. Also, GB27 is located medial to the ASIS, approximately on the same level. Needling this point is done vertically 0.5 to 1 tune. Caution should be exercised as this point lies the peritoneum. So we have to be extra careful because we could injure the peritoneum, and this point is also, we also exercise caution needling this point during pregnancy. So for its actions and indications, this point is indicated for Metrorrhagia, female infertility, orchitis, urinary tract infection, persistent lochial discharge. Now for the next point, or the door, Qimen, the door of Qi, still the Qimen, or the gate of Qi. It is located on the lower abdomen, 3 tune from the midline, level with REN4. Its actions, this point regulates the uterus and menstruation. Here we have an illustration showing where Qimen relative to other points like Zigong and Zigong, and the other point T2. For its indications, this point is indicated for infertility and heavy periods. Qimen has a special action in infertility and excessive menstrual bleeding. So again, this point regulates the uterus and menstruation. So it's good for infertility and heavy periods. Next point, we have the palace of the child, or Zigong. The extra point EX-CA-1. It is located 3 tune lateral to the anterior midline and 1 tune superior to the upper border of the pubic symphysis. How to find this point? The distance between the center of the umbilicus and the upper border of the pubic symphysis is divided into 5 proportional tune, which can vary considerably from the patient's finger tune. Therefore, only the proportional tune measurement should be used using a helpful device like an elastic tape. And from the upper border of the pubic symphysis, measure 1 tune in a superior direction. This is the location of REN3. From there, measure 3 tune in a lateral direction to locate Zigong. Located on the same level are kidney 12 and stomach 29. Kidney 12 is 0.5 tune from the midline, and stomach 29 is 2 tune lateral to the midline. Needling this point is done 0.5 to 1 tune vertically or 1 to 2 tune obliquely towards the upper border of the pubic symphysis. Again, caution should be exercised as the peritoneum lies beneath this point So we could injure the peritoneum if we needle deeply. This is also in pregnancy, we should also exercise caution and also needling this point on a full bladder. For its actions and indications, this point it strengthens and raises qi, regulates menstruation, and alleviates pain in the abdomen and the lumbar region. Zigong, or the palace of child, is located on the lower abdomen, 3 tune lateral to REN3. Again, its action regulates the uterus and menstruation. Here is another illustration showing where Zigong, which lies beneath or below Qimen and Qingzhong. Okay. Indications. This point is indicated for infertility, irregular menstruation, painful periods, prolapse of uterus, and heavy periods. Zigong is used to tonify the kidneys and to regulate menstruation. It is specially indicated for menorrhagia, metrorrhagia, and infertility in women. It has a long history of use in infertility. It is interesting to note that the 3 extra points on the abdomen, all of which influence menstruation and fertility, are all 3 tune from the midline and therefore between the stomach and spleen channels. These are Qingzhong, which is level with REN6, Qimen, which is level with REN4, and Zigong, which is level with REN3. It looks almost as if there were another channel between these 2 channels on the abdomen. So again, this point regulates the uterus and menstruation, which is good for infertility, irregular periods, painful periods, prolapse of uterus, and heavy periods. In combination with other points. So for infertility, Zigong is combined with REN3 for uterine bleeding. This point can also be used in combination with REN3. For ceaseless uterine bleeding, Zigong can also be used in combination with REN3, REN5, and bladder 23.